Unfortunately, back in the days, I lost my oldest brother Peter to suicide, and that was like the reason for me why I wanted to understand like what could be done in mental health care to really improve it and make it much better for a lot of people. So I used to be in diabetes before with my previous company. So I joined together with Riku and Albert, my co-founders, and we really went in and really wanted to understand like what is it that's going on in mental health care. And my brother's suicide, unfortunately, like kind of made me really think through like what's going on and what could be again done to improve things. And what I learned when I took a deep dive and like really went in and studied mental health care and what's going on, I realized that there's a huge issue with a lot of people actually not getting better, and that there's of course there's also an access problem. We don't have enough providers to treat everyone who needs help, but there's also a massive problem with roughly 2/3 of people who receive mental health care today, they're really not getting better. So that was something which I was so surprised to learn, that actually like our treatment today, like therapy, antidepressants, things like these, are actually not helping that many people. So only 1/3 of people are getting better, and only 1/6 of people roughly are getting into remission, meaning that they actually are fully free of symptoms of depression or anxiety. And when I learned that, I realized that okay, there's something here. So we really got to think through like how can we build something better into this space. So that's kind of how Meru Health was founded, and what's the reason behind it. So taking a difficult experience that I had, and also my co-founders had also like challenging experiences in their families as well. So we kind of came together with those thoughts and that mission to really build something better. With Meru Health, when we realized that the care today that's being provided wasn't adequately effective, really, kind of went deep in to understand like what's really behind the mental health crisis and what's really going on in psychiatry today. Like, how can we really understand better what could be done to improve the situation? So we developed this kind of a lifestyle medicine approach with Meru Health, meaning that psychotherapy and antidepressants, as I mentioned earlier, they are just not that effective for quite a lot of people. Like 2/3 of people are not really getting better. So what could help people get better? So I studied immensely, deeply went into the research and really wanted to understand like what are other things that are proven to help in mental health care and to help people get better, and what's the overlap with physical and mental health. And what I realized, which is super exciting, is that actually there's a lot of other things like exercise, sleep, diet, like mindfulness practices, like learning to regulate your nervous system, like deep breathing, like stress relaxations, things like these, that actually are very effective. But they're not normally made available to people, or they're not normally offered to people or prescribed to people when people have like depression or anxiety or PTSD or other things. So that's actually something which we decided to combine together with Meru Health. So we kind of built this approach where we deliver care in kind of traditional ways like therapy, and can offer like more traditional means of mental health care. But we also then kind of combine these unique elements, and this is something which started working really well. So we kind of got started and did some early work in 2016, 2018, and then started working with Stanford University and UC Davis to do research around our unique approach and how effective it actually was. And we were delighted to see that it's actually really effective, and a lot of people were getting way better results than what normally people would expect with the traditional means. So that's kind of how it all started, and that's kind of how we developed this unique approach and what the unique approach is. And today we have proven now in I think we've published 16 clinical studies now with Stanford, Harvard, with UC Davis, UCSF, other universities, and we've shown and proven that this approach is approximately 2 times more effective than the traditional mental health care. So yeah, super excited about that, and that's definitely something which we're now kind of taking out to the market and making it available for more and more people. There's many things to be excited about. So we work with a lot of large insurance companies today in the US, and we're now available to more than 40 million Americans. So a lot of people that are out there that can already get access to our care through insurance and reimbursed by insurance. So what we're doing today, we're contracting with further insurance to kind of expand our footprint, but we're also working out there in every state, in every zip code to make our care available and make it known for people that that Meru Health is out there. That there's a choice. There's something else that you can try, or you can kind of, get into if you're struggling to get better, if you're struggling with depression, anxiety, PTSD, bipolar, things like these. So so we're excited about taking Meru Health out wider and increasing the footprint. And we're also developing new interventions and new kind of modalities of care to even further enhance our care efficacy and the care experience for people that are in need out there. Compassion is one of our values as an organization. And when we founded the company with my co-founders, we actually went through a value workshop together even before we founded the company, to really go into like, what do we value, and why do we want to found the company? Why do we want to build this company and like this type of care? And compassion actually was one thing that we all felt is really, really important, and that the world is lacking compassion. Like, there's so many people who are struggling these days, and there's also so much like internal lack of compassion. A lot of people are not compassionate towards themselves today. So we wanted to make that as one of our values. And we all felt that by being compassionate, by being kind to each other and to oneself, that's going to be very healing for the world and for everyone around us going forward. And that also ties very closely to our offering. So we are a mental health company, and we're here to help other people who struggle with mental illnesses and mental health problems. So compassion is at the core of delivering a great experience, delivering care for other people who are in need. So yeah, compassion is dear to our hearts, and it's one of our core values as a company, and it's also something we deliver to our customers or our patients and participants, as well as our internal employees.